Hey fellas, Dr. Mountain here talking about cardiovascular health today. I have a lot of guys coming in wanting to know their risk for a cardiovascular event, either a heart attack or a stroke. A few things play into this. We'll be looking at the labs, at what lipid panels are telling us, seeing what the HbA1c is to see if diabetes has to play into the picture. Family history is also really huge. If you have a parent or a grandparent or a sibling who's had a heart attack or stroke, it's going to be really important for us to know. Sometimes genetics predispose certain people to it. We'll take all of that into consideration and then determine the best way to go about it. For some people, we might want to get a CT angiogram, and that's going to look at the blood vessels that supply blood to the heart and see if they are occluded or if there's any amount of atherosclerotic plaque built up in there. For the most part, the top 3 things that I recommend to patients would be diet, exercise, and sleep. Really key foundations for our overall health, but especially our cardiometabolic health. Let's get into the diet. Diet is really confusing. Over the years, and especially now, there's conflicting advice about the best diet for everything. Across the board for cardiovascular health, we normally see that the Mediterranean diet and the DASH diet are most recommended. So anytime we can get patients anywhere near those diets or close to having a diet that resembles them, we see a lot of improvement in patients' lipid panels. The next thing is movement. We have to keep exercising, get blood pumping through the arteries to make sure that the arteries are flexible and not stiffened and tightened up. The next thing is sleep. A lot of patients don't realize that sleep apnea can really worsen someone's cardiovascular health. So taking a look at that, seeing if you're actually breathing throughout the night, turns out to be pretty important. Beyond these 3 basics, there are a lot of other things that we can do to really get an idea of someone's cardiovascular health and how we can optimize it. If any of this resonates with you, if you have any questions, want to learn more, feel free to give us a call and set up an appointment.